There are certain recommendations that are in the literature regarding eating and drinking, but again, there may be variables depending on the surgery, the surgeon, the location, that change those things. So it's very important to get those things straight from the particular individuals who'll be caring for you.
Okay. Yeah, and that's it.
You have to go through to get ready for this surgery.
Well, I had to make sure that I had someone to pick me up and take care of me for the proper amount of days afterwards. And yeah, definitely make sure I have someone watching my back.
So, so it'd be fair to say that you can't just plan on showing up and having surgery, have something done, and go home and jump right back into your life.
Strolling home.
There's advanced planning, which includes investigating the surgeon, the surgery, the anesthesia, the anesthesiologist, the facility, planning for your transport to the facility where the surgery will happen, and then also being realistic about your care afterwards, whether you need medications. For instance, I know that you had prescriptions for the surgeon that you filled before you ever got here today for the surgery. So, that's planning ahead so that you've got things when you need them, as opposed to getting calls at 3 o'clock in the morning that you never got your pain medication.
Right. Definitely be organized so you don't have a lot of things to do. Have meals ready. Go grocery shopping.
And some of those issues for the specific surgeries are covered in other than Naked Truth tapes that you've seen, aren't they?
Definitely. Watching the Naked Truth series definitely kept me up on things, and my surgery packet was extremely helpful. I've read it inside and out.
Okay, so you did the workbook, you followed the packet, and you. It makes everybody's life easier when the patient is educated, and when the patient is knowledgeable and has a sense of control over the events. I think it makes everybody happier.
I slept good last night.
That's great. Now one of the things to cover after we've had the intellectual discussions is what's happened to your feelings inside. I mean, you've gained some knowledge through these discussions. You've hopefully had some questions answered, but has that done anything to change your state of anxiety or not?
I'm not as nervous as I was now that my questions have been answered, but I'm still definitely a little nervous and hungry. Very hungry. But I'm excited, and I'm looking forward to my first experience with anesthesia. This will be good to me.
I'm going to put you to work on some of it. You can use both hands. You can try to use both hands.
Do you want it all in here?
Pretty much, because I don't want to get the prep solution on it. So, great, that's fine. We'll do the fine tuning afterwards. That's got most of it. That's yeah. That's okay.
Is that good?
And we'll take care of insulating your ring afterwards, because we don't want metal to come in contact with metal. So if you have a ring on that you can't remove, we've got to insulate it. So that's just one of those little things that we worry about.
How do you insulate it? You just wrap it?
Wrap it with something resembling electrical tape, actually. Forward here, and then we're going to back up into the operating room. Clearances issues. You can't have music right now. Garth doesn't want to pay for that. As soon as we get the bed locked, which I believe it's just been taken care of, we need to get you, Michelle, to scoot from where you are to this other bed. Then we're going to start the process of getting things padded so that you don't get any pressure-related problems. There's a special gel pillow. Scooch up towards me. This pillow to keep track of you while you're asleep, and that's what we're doing right now. We've got a blood pressure cuff on your right arm. In a moment, that will squeeze on you. We have another device that's the pulse oximeter that will go on the finger of your left hand here. So let me just have you pull that up and we'll put it on the index finger of your left hand. We have some EKG leads to keep track of your heart rate.
Sounds good.
And you hear the monitor beeping in the background so that we know
Is that me?
that's you, babe. We know that you're alive. And reach behind you.
What's that?
This is one of the EKG leads. There'll be 3 of those. They're cold, and for that I apologize. I'm not going to do anything about it, but I'll apologize anyway. And let me reach behind you for this third one. Great. Okay. Now, in the process of this, you've wiggled towards the foot of the bed. So wiggle back up. So your head, keep your head kind of centered in that pillow there, okay? For today.
Because it would have been in dreads if it was curly by next
Okay.
week.
Alright. Where the IV is now, you'll feel some pressure for sure. You may feel some burning. Even though we mix the local anesthetic with this medication to help get you off to sleep, it sometimes burns anyway. If it does, it'll go away real quick.
What does that mean?
You know how the little cameras have things that tell them when they're up to speed? It's the anesthesia equivalent.
I felt the burning.
Oh, okay.
But
Not
it's
too
okay.
bad, alright?
I'm feeling pretty drunk right now.
At least you can still smile.
I am so excited.
It'll be about 2 minutes before we get to the point of intubation and that sort of stuff. You know, and that's just a graphic example of what we were talking about before, is having enough alternative supplies and devices and such to be able to take care of these issues should they occur. So at this point, we get to patient protection land.
Focusing on her, getting her all set up.
Yeah,
And
okay.
then we'll go through the punch list.
Okay.
Alright, you got the ring now. So we do the arm padding.
Yep.
Interestingly enough, we have some arm pads. What could that be?
Why do you use the arm padding?
Why do we use the arm padding? It's a perfectly good question. There are a couple of things that can occur as the patient is lying down. We have a pad on the bed. We have a gel pad on top of that. And still we have to pad areas where nerves could be compressed for a period of time. Permanent nerve damage can occur with pressure on a nerve for as little as 10 minutes. So permanently damaging the radial nerve or the ulnar nerve, which are vulnerable at the wrist and at the elbow, is not a good thing.
So you're saying this is different than when you sleep on your arm at night and it's not?
Well, you're able to move. You don't know it, but you move a lot in your sleep. So you wake up and it's numb, but that's probably only been a couple of minutes really in that position. She's not able to tell us anything, so we have to act proactively to prevent that. On top of the fact that we have the arm pads, we'll also pad the heels because those are areas of continuing pressure. And we're going to put on some sequential compression stockings. One of the things we're concerned about in any surgery is the development of venous thrombosis or blood clots in the deep veins. So on every patient, unless they're having an operation on the lower leg, we'll put on these sequential compression devices or stockings that squeeze the leg, mimicking the act of walking. That creates eddy currents in the veins all the way up to the mid-chest, which prevents the development of blood clots in the larger vein.
Can I start prepping her?
Yeah, just check. This is an antibiotic. Michelle. Michelle. Hi there. Surgery's all done. Smile. Okay. We're in the operating room. We're getting ready to go to the recovery room. So, everything's okay. You're welcome to sit up and look around. Nobody here will bite unless, of course, you give them specific permission.
Hey Michelle, it's Nicole. Hey there. Surgery's all finished, okay? There you go. Just gonna move you to the other bed, okay?
So, just kind of hold still there, sweetheart.
I got you.
Okay. You're going for a ride.
Okay, sweetie, just hang on, okay? 1, 2, 3.
Right. If you would be so kind as to crank the head of her bed up. Michelle. Hi, you're done. Surgery's over. Wait a minute, guys. Let's not take it. Part of it. Only part of it. I'm sure there's more coming.
What?
Hey there. From rushing in without you.
Michelle, are you in any pain? No?
That's okay. You don't have to be.
Are you cold at all? No? Okay.
We'll get some
I'm just gonna
hot
put the
air
warming
for
blanket on you, okay?
general principles that'll help you feel better. Even if you're not cold yet, the chances are you might be.
Open your eyes for me. Hey, it's all finished. It went really, really well. Okay? Your mom's in the waiting room. Okay?
Sneak yourself away.
I dreamed
What did you
What'd you
dream?
dream?
about surfing.
Surfing? Yeah, we won't be doing that for a little while. Oh.
No, that's
Oh.
okay. Just you need some weight.
Michelle, so surgery's over. How do you feel? Do you feel like you're awake? Are you sore at all?
No, not too sore.
No.
My throat is a little sore. I'm a little chilly. But other than that, I feel...
Do you know what time it is? You know where you're at?
Mm-hmm. It's about 10. Yeah. I feel pretty good. Yeah.
Good.
Not as nauseous as I thought I was gonna be. A little chilly, but that's all.
So it's since it's your first time under anesthesia, is there anything that you didn't expect or expected?
Yeah, how quickly it goes. It goes very quick. And I didn't remember even going out. It was...
And when you woke up, you just said anything, how were you feeling?
When I woke up, it was just like waking up out of sleep. But it just was a little groggy. It just takes you a while to just come through completely. But it was, no, not as bad as I thought at all. Not as nauseous as I thought. And, I'm okay. I'm okay. How long was I under?
For about 3.5 hours.
Wow.
Speaking of location, it is not worth risking your life by having your procedure performed in an understaffed or unaccredited facility. In the course of evaluating your surgeon and anesthetic provider, don't overlook location.
Each healthcare facility has very strict criteria for the administration of anesthesia and sedation, with privileges usually established under the rules of the Department of Anesthesiology. Hospitals have to follow stringent requirements for their continued participation in Medicare and other federally funded health care. Nonetheless, hospitals can be subject to discipline and probation by accrediting and certifying agencies. Be sure to determine the current status of the hospital before receiving care. In some outpatient surgical settings or in some office-based surgical settings, these rules are followed less stringently. If you are having your surgical procedure performed in an outpatient setting, be certain the facility you are considering is certified by a legitimate accrediting body and posts the appropriate state license. Some of the most widely recognized accrediting bodies, in addition to a state license, are the Joint Commission on Accreditation of Healthcare Organizations, or JCAHO, Medicare, the Accreditation Association of Ambulatory Healthcare, or AAAHC, and the American Association for Accreditation of Ambulatory Surgery Facilities, or AAAASF. Facilities accredited by any of the agencies have to follow strict criteria for your safety. How should you choose an anesthesiologist? Perhaps you have noticed that we have used the term anesthesiologist throughout this program. Earlier, we discussed his or her role and educational background. We have not mentioned other anesthesia providers, including nurse anesthetists, anesthesia assistants, or physician's assistants with special training in anesthesiology. There's a good reason for this omission. None of these other anesthesia providers are physicians. An anesthesiologist is a physician who has completed post-medical school training in the medical specialty of anesthesiology. No one, apart from an anesthesiologist, is fully trained in the medical specialty of anesthesiology.
Anesthesiology is a medical specialty. To the extent that a nurse anesthetist works in conjunction with an anesthesiologist, there is the ability to expand the services to the patient. It's my opinion that apart from the provision of emergency care or the absolute unavailability of a physician, there is no place for an unsupervised nurse anesthetist providing anesthesia. I am not disputing the fact that other non-physician anesthesia providers have attended scores of successful procedures. However, their experience and knowledge base simply does not prepare them to handle complications as well as a physician anesthesiologist. Furthermore, the presence of a surgeon does not guarantee a detailed knowledge of the requirements necessary to address anesthetic complications. Only an anesthesiologist has the specialty training, earning him or her that exclusive title.
Once you determine if the anesthetic provider is indeed an anesthesiologist, how do you differentiate one anesthesiologist from another? A degree from a prestigious institution is not necessarily a guarantee of quality care. A physician who barely passed courses at his famous alma mater is unlikely to be as good at providing care than one whom excelled attending a less recognizable institution. Similarly, membership in specific societies offers no guarantee of the quality of care. Membership in each of the medical societies is voluntary, not mandatory. Membership in a society identifies the desire to be a member and the ability to pay the dues. It is not a testimony to a physician's ability. The only true way to differentiate among anesthesiologists is to ask if he or she has a certification from the American Board of Anesthesiology. In fact, the pass rates for this board's written and oral exams are routinely lower than those of other specialty boards. The physician who passes both written and oral boards on their first try has shown a great depth of academic knowledge. If he or she has also been a member of Alpha Omega Alpha, a medical school's honor society, you can be sure that the credentials are sound.
Now that you have an understanding of anesthesia and can differentiate among providers, we need to further draw a distinction between the way you choose your surgeon or physician and how you choose an anesthesiologist. Among other criteria, patients usually choose their surgeon based upon skill, reputation, compassion, and certification. As we mentioned before, once you've committed to surgery, the necessity for anesthesia is presumed. Choosing an anesthesiologist is altogether different. Plainly put, you do not have voting rights, but you do have veto power. What does this mean?
Most hospitals have contracts and privileging issues with prescribed anesthesia groups. A surgeon utilizing an operating room in a given hospital generally has little say over who the anesthesiologist will be for a given case. Typically, the anesthesiologist is assigned. In other settings, the surgeon might have a relationship with an individual anesthesiologist or group. If a surgeon has a good working relationship with an anesthesiologist and they share a good track record, the value of that team may exceed the value of your personal preference. The best needs of the patient are met when the anesthesiologist is knowledgeable about a particular surgeon's techniques, skills, and desires to provide optimal surgical outcome. So if your surgeon has a preference, you may want to heed his recommendation.
I hope we have taken some of the mystery out of the subject of anesthesia. Knowing how things work, alternatives available, who to trust, and defining roles all help toward managing expectations during a stressful time. Keep one thing in mind. You may be considering major surgery or a minor procedure. But if any form of anesthesia is involved, never take it lightly. It could be life-altering. Learning all you can about any medical procedure will help you feel more like a participant and less like a victim when it comes to your health. We are dedicated to empowering you through knowledge and appreciate your interest. We hope that this educational video will be of help to you.
Naked Truth Product Company, NTPC, Carl R. Novak, MD, GFMB Product Development LLC, and GFMB Holdings LLC, collectively Producer, have provided this video and affiliated website and the information on it, collectively the service, for educational purposes only. This information is intended for prospective patients. Nothing contained in the service is intended to be, nor shall it be considered to be, instructions for diagnosis or treatment. Although Producer makes a conscientious effort to provide accurate and current information on the techniques, risks, and benefits of modern anesthesia techniques and procedures, Producer disclaims any implied guarantee about the accuracy, completeness, timeliness, or relevance of any information in the service concerning techniques or risks to patients. Risks other than those discussed or demonstrated in the service may affect any particular patient. You should see a qualified anesthesiology specialist if you have any questions